in the form of Dr. Gangadhar Sundar, a very dear friend and a friend of oculoplastics in India, and very much a part of it, who will be also delivering a keynote address. So we kept it for the last for the simple reason that the lacrimal, he is going to talk on something very new and innovative in lacrimal surgery, and that will be clubbed with the lacrimal presentation that we have. So, so the speakers, the first slide, please. So we have a course wherein we have speakers from different parts of the country. Dr.Moupia Goswami from Narayan Nethralaya, Bangalore, who was my fellow at Shankar Nethralaya many years ago. Dr. Aarti has been my fellow and my colleague at Pammal Sankara Eye Hospital, which is one of the hospitals I'm associated with in Chennai. And Professor Nitin Trivedi, of course, has been a teacher to generations and a very prominent person in the Nagari Eye Hospital and Ahmedabad's oculoplasty and ophthalmology. He's been a president of the Oculoplasty Association of India and is a great teacher. So I think that was what really motivated me to bring him here. And of course, our friend Gangadhar Sundar, who's known to all of you very well, is the Indian ambassador to Singapore as far as medicine and ophthalmology is concerned. And he's helped generations of students get positions in Singapore, and generations of Singaporeans to come to India and get exposed to the wonderful medical teaching, training programs here. So he's been a great ambassador and a very dear friend for nearly 2 decades. Next. So this was the little poster and the WhatsApp. You know, today you can't do anything without some publicity. So I have done that. So let's see, as the hall fills up, we'll know how much it's effective. So we start with, I won't spend much time on the importance of minimally invasive surgery, because nobody needs to be told about the importance or the good things about minimally invasive surgery. For example, a lot of developments in cataract surgery, including sutureless cataract surgery in all its forms, including phacoemulsification, were driven by patients. Though technology drove it, in the end, there were many ophthalmologists were pulled in, screaming and crying and howling and cribbing. They were forced to convert, because I belong to a generation which spans both the views, both the opinions of whether we should do, no, ECCL is very good, bahut acha hai. Why should you, there's so many complications. Cornea goes for a 6, the nucleus drop. Once you have a nucleus drop, you keep trying to revisit the past, but you can never revisit the past. So in that sense, what we're going to show today is going to be technology and techniques which are going to be there forever. Or nothing stays forever, but for a long, long time. So in that sense, we don't have to discuss about the importance. Every field of medicine, I practice in a multi-specialty hospital as well, right from the cranium down to the foot, thorax, abdomen, liver transplants, hepatectomy. Everyone tries to do things through a limited incision, through endoscope, laparoscope, or other approaches which don't give the patient a scar. Irrespective of age, it may be a baby, which you're going to see now in my presentation, who's a month old, or an elderly gentleman who's 85. Every single patient of yours, mark my words, is going to appreciate if you make the effort to give them no scar or a minimal scar, period. If you do that, your efforts will be worth it, and that is why the course. We have the first formal talk on applied anatomy by Dr. Aarti, followed by something on minimally invasive orbital surgery. These are all very visual, very video-driven talks. Then Professor Trivedi will talk on eyelid surgery with Scarless and aesthetic approaches, followed by Dr. Moupia. And of course, before the question and answer, I didn't have time to change this, Ganga. Keynote address by Dr. Gangadhar Sundar, and then we'll have some time for interaction as well. Dr. Aarti.